Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about hyperhidrosis. So, there are times when people come in and they have really, really sweaty feet. They may have an odor associated with their feet. They may have even problem with their shoes stinking, or even they may even get an athlete's foot or something similar to that because their feet are staying so moist. So athlete's foot or fungus in their nails because the feet are constantly wet. The other problem with your feet being constantly wet is you also increase your chances of blisters and some of those kind of things as well. So hyperhidrosis, hyper meaning extra, hydrosis is sweating in this case, then you're sweating too much. And so the idea is you need to do something to decrease the sweating in the feet. Some of the things that you can do, you can actually change your socks multiple times a day. You can make sure you're wearing appropriate shoes that allow air to pass through and not wear types of shoes that maintain the heat or the problems that happen in the feet that way. You can wear different types of socks. A lot of times when we're talking to people that are running, we actually recommend that they wear a nylon sock next to their foot and a cotton sock around it, because the nylon sock lets the moisture pass through it and the cotton sock absorbs it. But by having the two layers, you're actually not having moisture right next to your foot at all times. But there's actually now some treatments that actually work really, really well for hyperhidrosis. Dry body is what it's called. It's actually a type of wipe that you can actually wipe the foot, and it works typically for 7 days. So for 1 week, it decreased the amount of sweating. So you can actually use a single wipe on both feet. For 7 days, you're having decreased sweating, and it improves some of those symptoms and some of the problems that are associated with that. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 90, hyperhidrosis. It should be treated because it's going to prevent many of the other problems that come with your feet staying too moist. This is Dr. Brandt Gibson. Have a great night.